foreseen any situations where the ultrasound wasn't used where you didn't feel comfortable other than that first time, but where you felt comfortable with the ultrasound but you didn't feel comfortable with the situation? As far as like saying, hey, why aren't you using ultrasound? Or we could have this diagnosis in less than 30 minutes and you felt like that wasn't gonna fly.
That happened to me a lot during my third year. I'm kind of a shy guy, so when I first got into the clinical realm, I just sort of hung back and didn't really raise any of my concerns, even though I had some. But as I've gotten more used to the clinical environment, I've been just gently suggesting ultrasound, and it's generally been very well received.
Have you had to do a lot of teaching?
I have done a little bit of teaching.
The student as the teacher.
Yeah, it's a little bit of an oddball, but again, very well received in general.
Are there any challenges you guys see to having kind of the skill where you really, as a student, are the expert?
I think probably the biggest hurdle, I guess, is kind of that education, that kind of two-way street where, yes, we may not have all the clinical acumen, but if you look at the IE technique, we know the primary indications for a lot of these procedures and at least how to acquire the images. Now, kind of that next 3 and 4 step in terms of what to do with the patient and what medications to do or who to consult now or where they go to surgery or not, maybe we're lacking in that, and that's just due to lack of experience, but you know, we have that arsenal in our set that we can say, hey, I know how to at least assess for this, and then maybe we can talk about what to do with it afterwards. But I think just kind of bridging that gap between maybe the attendings or senior residents or interns don't know how to get the images, but you say, hey, you know, I do. And if it's okay, I can come in with one of you, and maybe we could do it together and kind of formulate a plan from there.
Yeah, I think it's more or less just as you said it. I think the stopgap at using ultrasound is the acquisition of the images, and because of that, people don't think to use the ultrasound machine, and you have to be the one to suggest using the machine and tack on the fact that you can actually acquire the images. And once you do that, people become much more open to, hey, I can tell you what that picture means and what to do with that result, and we can work collaboratively.